Welcome to the TechLink Health Podcast, an on-demand source for the top trending healthcare topics and insights. Delivered by key opinion and emerging leaders and as featured on the TechLink Health app. The healthcare industry is rapidly evolving, so our goal is to connect listeners to the most relevant insights, ranging from digital health to financial well-being to interesting side gigs. For more details, visit www.techlink.health.
Well, hey everyone, welcome back to the TechLink Health Podcast, where we explore the intersection of health, technology, and innovation. I'm your host, Dr. Sarah Saman, and in today's episode, we'll dive into the transformative world of the Internet of Things, or IoT, and its specialized branches, the Internet of Healthcare Things, or IoHT, and the Internet of Medical Things, which is sometimes called IoMT or MIoT. Many of these technologies are revolutionizing how we think about healthcare, personal safety, and connected care. And to provide additional context, here's some market projections, industry trends to be considered. The medical Internet of Things, or MIoT market, is projected to grow from $93 billion in 2025 to $134 billion by 2029. The smart hospital market, which encompasses AI, IoT, and robotics, is expected to reach $148 billion by 2029, as forecasted by Deloitte. And globally, it's estimated that between 2.2 million and 3.3 million medical devices are connected to hospital networks. This highlights the rapid adoption of connected healthcare technologies. And these trends will have profound implications on global health in terms of enhanced patient monitoring, improved operational efficiencies, and advancement in the quest for more accessible and equitable solutions. And while it's important to discuss these macro trends associated with the industry, it's also equally as important to hone in on specific devices and technologies that are playing a key role in our day-to-day life. So in past episodes, we've talked about challenges associated with an aging population. And in today's episode, we're going to dial in and look to connect the dots with connected devices that are focused on sending medical alerts. As a quick highlight, 1 in 4 adults over the age of 65 fall each year, which is a significant number considering that falls are the leading cause of injury-related death among adults ages 65 and older. The golden hour is the critical first 60 minutes following an emergency event, when receiving treatment is believed to offer the greatest chances of survival. So here to talk about all of this and more is Shailyn Simmons. She's the CEO of LogicMark. LogicMark provides a comprehensive platform of technology products and services that enable the Internet of Things, or IoT. It provides technology products and services in healthcare communications and personal safety applications and services. So it goes without saying that Shailyn and LogicMark team are playing a tactical role in creating connected solutions that are contributing to the mission of health and safety. And we look forward to getting her perspectives on the podcast. So without further delay, we're excited to welcome Shailyn of LogicMark to the podcast. Shailyn, thank you so much for joining us today.
It's a pleasure to be here, Sarah. Thank you.
So to start and to give our listeners some background, can you take a moment to introduce yourself in a bit more detail and tell us about your journey into the IoT connected devices space?
Well, thank you. I am the CEO of a small nanocap company called LogicMark on the NASDAQ, and I've been the CEO since June of 2021. This company has been around, however, longer than I've been here. It's been around since 2007. We have been proudly serving the largest hospital network in the United States, which is the Veterans Administration hospitals, since going back to 2007. And we today continues to provide as one of the number one, number two providers of these medical alert products, or what we call in the industry PERS, personal emergency response systems, to the Veterans Administration, as well as other hospital networks and their caretakers as well. It's been a pleasure to be working at this company, but this is not my category of background to work on medical alert products. but it's been a really amazing journey to be here.
Fascinating. So you've really been involved in the cutting edge of technology in the healthcare space, and I'm looking forward to hearing more. Thank you for that introduction. And it's great to learn about your journey and how it's led to your role as a leader in the industry. So now let's dig into LogicMark's solutions and broadly some of the technology that is powering the IoHT solutions. So it's noted that LogicMark operates at the intersection of IoT and healthcare, and the solution leverages technologies such as mobile apps and Bluetooth. So these are things that most people are familiar with. So how can you provide an overview of how LogicMark technology works with these types of technologies and its primary focus area, and also what the core challenges are in creating IoT solutions for healthcare and personal safety, and how LogicMark addresses those.
Sure, not a problem. So, as mentioned, I was not the original CEO of this company. I was actually brought on to this company because when I joined in June of 2021, this company hadn't really evolved its technology since 2015. We had not been a connected sort of product. And this particular industry as a whole, even though it had connected products, was not a very sophisticated one. So, having been in a technology space for more than 20 plus years, I spent a good chunk of my career actually working on things such as connected home and all the way down to things like connected cars. And so, always with a very difficult user interface in terms of trying to address a market that perhaps, for example, in a connected car, your attention span needed to be focused on actually driving, but you're trying to absorb and deal with a connected sort of space. And so, from a logical perspective, getting into this particular company didn't seem like such a far fetched idea. But what was really intriguing to me was exactly a lot of what you were talking about. This industry is evolving, it's changing. There's a lot of differences in terms of technology that's being introduced. But when we were seeing all of these amazing changes in the connected space, IoT space, down to vehicles, which typically has a 7-year engineering cascading model, this was an industry, ironically, in the medical alerts product that has been super static since, and I grew up with these ads, the I've fallen and can't get up ads from the 1980s. And so when you look at these devices, they look like mini remote control for your garage, right? It's a big button. And some of them may be, quote, sophisticated by having some type of fall detection. They really weren't doing very much outside of a very singular sort of accelerometer, one sensor based just on speed and detecting what falls look like. And so, one of the reasons why a lot of the seniors, the 1 in 4 over 65, as you mentioned, don't wear these devices is because they are disruptive. They're often incorrect when the fall detection is launched. And so, the experience is that you could be sitting down too quickly and the device will go off, and somebody in a monitoring service would jump up and say, "Mrs. Becker, are you okay?" And of course, it's always at the most inopportune moments. And so when we look at these technologies, we're really looking for two sort of sides, which is one, how do we become the best reactive technology out there? Which means that how do we develop the technology so that we can get you to the golden hour faster to be less disruptive when we're basically trying to figure out what's a false versus not a false, the false positives, eliminating the false positives, and to be better and better at connecting you to your caretakers in a way that makes sense. And that's amazing to be able to be better at being reactive technology. And I think a lot of companies would be super happy with that. And certainly we are very focused on trying to be the single best out there. And that means for LogicMark, how do we provide a better AI enabled fault detection algorithm? Not just using one sensor, but using multi sensors, whether or not that be sound, using a gyroscope for tilt, as well as the speed. Everybody uses speed, that's the standard. And so I'm a geek. Using one sensor for something is just not good enough. It's like having more than one points of data to understand a situation is the best way to understand if it's real or not real, false positive or not false positive. And so having that opportunity and being a better reactive technology so we can get you the help that you need is really crucial. How do we not let you have that first fall? How do we make you not that senior that actually experiences that fall in the first place? Is there a way that we can look at the pattern of usage, pattern of your life to basically be able to better understand when you're at a higher risk of a fall coming forward, and then being able to get that information to your caretakers into professional caretakers so that in fact we could eliminate that risk in the first place. Maybe that's assistive technology, maybe that's physical therapy, but giving you at least a little bit of a heads up that something might be coming. And that is actually where the excitement of integrating things like AI and ML in this particular category space is so important now. It's to basically be not just a great reactive technology, but being actually in a predictive side of the business.
Thank you so much for those valuable insights. And I can vouch for what you said about people being reluctant to use these devices. My own mother had the same exact experience with the old style device going off inappropriately. And she basically stopped using it, which was to her detriment, unfortunately. And it sounds like you have a deep knowledge of how consumers interact with tech and beyond just the tech itself. And I think it's fascinating the idea of incorporating AI and making these things better for people. And it gives us a different way of looking at AI. So, when thinking about technologies and solutions, it's sometimes difficult to envision all the ways these solutions are being used to create a positive impact. And with that being said, can you share some examples of how LogicMark's solutions are being used in real world settings? So, you explained some of that to us, and I'd love to hear more. And also, what impact these technologies have had on individuals and caregivers, as well as healthcare providers, such as the VA system and others.
Sure. So today, a standard device has a button and it doesn't really provide any more additional data. But we really understand that actually, when we think about long term health monitoring and when we're thinking about basically helping people, it's not just about the singularity of having a fall. Because these devices, typically, what they're meant to do from a medical alerts product is that it serves as a medical alert product, but it's a communications device at the end of the day. And so, what we really hope to do is to be able to help you with a number of issues. And so, first and foremost, like one of the things that we really have been innovating on is how do you create a device that actually can help you do a little bit more? And so, medical alerts today, you fall or you don't fall, fall detection happens, and we're better at the fall detection than anybody else. So, we help you if you actually fell over and can't speak and can't push the button. And what we do is for us, we actually have the medical apps for the caretakers that allows them to receive it as quickly as possible. And that's really great on our more basic product. But when we introduce the sort of more advanced products like our Freedom Alert Max, what it does is it allows our caretakers, and it could be a daughter who lives one state away and can't be there, is to be able to say, oh my goodness, emergency has triggered. And I don't think it's a false alarm, but let me check. And so what this does is has a front and back camera. And so it actually allows the caretakers to be able to see whether or not there's actually a physical identification, a visual identification of a fall. And so the thing that comes up, and then this should be first and foremost in everybody's mind is, gosh, I don't want my adult children to peep in on me whenever I'm walking around. That's just very invasive. Who's the kid here? Right. And so we've put all of those things in mind, and we actually created a product where your kids can't just randomly pop in on you just because they're worried about you, right? So they can actually trigger this only if an emergency has been triggered and you didn't turn it off. And so then we can not only just detect it, but we can actually have a visible confirmation for your caretakers who may not be with you at the time. But because there's a screen now for us, it also allows us to basically deal with things like launching a service that we plan to launch this year, which is Medicine Reminder. Meta-adherence is so important as part of a general health and aging at home situation. We also know that actually meta-adherence may actually have a lot of ties to whether or not you may actually be at risk for a fall. And so what it allows us to do is to basically give you not just a reminder, but we hope in the future to give you a visual reminder, because I don't know about you, but when my mom was taking a lot of pills, there was quite a lot of different things and she didn't always remember which one was which. And not only that, but as a person who is not as well versed in the medical industry as you are, one of the things that really confounded me was that when you tell people take Coumadin, for example, blood thinner, in fact, Coumadin comes in like lots of different shapes and sizes and colors. And so this isn't always easy to remember. And so there is a reason why a method to our madness to put actually a screen in, because long term, we hope to be able to give you things like reminders of that nature when we launch these types of services in the future. And we really see these medical alert products as a way for you to get help when you need it for the golden era. But we want this because this is something that's persistent with you. So long as we don't make it look horrible like a garage opener or make you feel like an old person, these look like cool little phones. And you can actually call your family on this product as well. So 2-in-1, you don't have to carry a ginormous cell phone as well, right? Something light, something you can wear around your neck. But because it's a persistent product that stays with you and lives with you, then we actually have a way to help you whenever you need it the most, but also be part of your health monitoring experience. And so we think that convergence is what's going to happen in the future. And certainly, even for us, as we're developing our technology, one of the major questions is this may be splash proof in a shower. More and more, as we get more sophisticated in terms of introducing technology, what happens when you're in a shower, right? 50% of falls happen in a bathroom. So we look at things like what are we doing in terms of innovation for a non-wearable, for remote monitoring the home so that the most dangerous of all places for people for having a fall, the bathroom, still gives you the security and privacy that you need, but that we're able to discern exactly what's happening and whether or not there's a fall, but that you don't feel like we're eavesdropping. We don't want to be constantly listening. We want to be able to listen for the keywords and key things that is helpful and then dump the rest of the data that's not helpful for us to help you. And so these are the areas of innovation that we are actually moving forward with. So that's really helped a lot of the folks that's actually part of our customer base. So we just got Freedom Alert Max onto the GSA contract for the federal government. And they're excited about this because there's opportunity for them to provide additional services to the veterans. For example, for the Freedom Alert Max going into the Veterans Administration, we actually put in a crisis hotline. So veterans are at high risk for suicide and for a lot of PTSD. And so they have a real need there. And so we're able to introduce that because we actually have a flexible platform system that allows us to add that service as a part of our service to the federal government. And so this platform that we've built out at LogicMark gives us a flexibility to tailor our services and offerings to a lot of different people in terms of what their needs look like. Alzheimer's and memory care patients, we have geofencing so that you can track your parents if they're actually outside of the boundary.
So those are all such important uses. And it sounds like you've really researched your patients, the different sectors of individuals that would need or could benefit from this type of product. And especially this idea of a crisis hotline being immediately available so they don't have to look up a number and pick up their phone and make a call. It sounds like something that could really potentially save lives. And I know our listeners can't see it, but I'm looking at the device and it's smaller than a cell phone and at least as thin, if not thinner than a cell phone. So something that could easily slip into a pocket or hang around someone's neck without a lot of weight. It looks like a very handy and well designed appearing device. So, in the opening of the podcast, we talked about some of the market projections and industry trends that are related to the IoHT and IoMT sectors. And it's clear that these types of solutions are poised for future growth and impact at global scale. So, how do you envision these technologies evolving over the next 10 to 15 years? And what do you expect we might see when we project out to perhaps 2040? And along those lines, what do you see in store for the future of your company, LogicMark?
Sure. It's interesting because I'm a technology executive. I spent all of my career in the technology industry outside of a 3-month stint working for a pharmaceutical company in business school. I'm very interested in understanding how do we provide longevity, right? The aging at home, part of that mindset of being able to age at home in an environment that best suits you, actually, I think is well suited to the idea of longevity. You're going to be happier if you're in your own environment. And so we think about that a lot and what's the best way to basically age at home and to feel safe and secure. It's really, in many ways, we're very focused on, I think, one of the three sort of areas of aging well, which is the physical health. There's also the question of mental health and, of course, financial health. And so we feel like we're touching two out of the three branches of that. And so how do we utilize these devices? We talked about the crisis hotline. Are there services in the future, for example, that allows you still to feel connected to your care village as an immigrant, I grew up in a multi-generational household. It was very usual for me when I was growing up in a different country that there was multi-generations, uncles and aunts. And so there's always an adult watching over somebody, and then there's an aging person, and then you're watching over them. You get old enough, you drive your grandparents to doctors, right? And so today, in the world that we live in, we're much more nuclear oriented, but doesn't mean that we wouldn't have a care village. And so we see our product as part of the long-term experience of being one portion of and a method or a tool of helping people bring together a care village. That care village may be your child from one state, 2 states away, 30 minutes away, as well as your next door neighbor. But all of us are connected via an app and service. We can coordinate care. If I'm on a call right now, then my brother or sister is on call for my parents, along with my 24/7 monitor service. So looking at in the future, the trend is what are the technology and services, not just to be able to help monitor patients, but how do we bring together a team of people, of caring people, a care village, professionals, personnel to basically be advocates for the patient and the user. I think that's one of the trends that we should be looking for up to 2040. I think secondarily, a wearable solution is part of a larger IoT solution that when you're in your home, you should expect our company and other companies to be looking at what's the easiest to use experience to basically deal with health monitoring that is non-wearable. Because the reality is that trying to remember to put your device on while you're in a home, it's a little cumbersome if you're wearing PJs and you're still wearing a device. Our devices are cute and they're smart and they're small, but they're still cumbersome. And at some point, because they're electronic, they need to be charged. So how do we provide you with a solution that has that sort of what I call the relay race concept of passing off things to each other so that when I'm charging my device, it's part of maybe a larger listening experience. And so that it's listening in the bedroom along with a speaker, for example, if I'm in a shower, so that if it hears a fall in a shower, that it's actually part of an interconnected sort of system that's going to get me the help that I need. So that solution of IoT is where that merging of wearables and IoT should be collapsing together in a future for healthcare. And then I would say that the other trend to 2040 is the deep integration of AI and ML in terms of offering personalized, truly personalized care. So today, when we talk about predictive analytics at LogicMark, we're very excited about the kind of work that we do because what we're trying to figure out is Mrs. Becker, every Tuesdays and Thursdays, she looks like she had a fall because she's like dropping really quickly and it's 10 o'clock and it looks like a fall. And we check in and we're like, hey, are you okay? Discreetly. And she's, yeah, I'm fine. But we notice that there's a pattern, Tuesdays and Thursdays, 10 o'clock. And then we look at the geolocation, looks like a yoga studio. So we're like, okay, Tuesdays and Thursdays, we're not going to bother her because this is what is happening. But we're also then noticing that she, who is an active 10,000 step a day walker, has suddenly shifted her pattern. So she's now gone to 8 to 6,000 steps a day. And so we're seeing a pattern differential. I don't need to know that she is taking 8,000 steps to 6. I just need to see a trend differential, right? When I combine that with the fact that Mrs. Becker might have missed her blood pressure medicine like 6 times out of 40 in the last month, then I'm now well aware of a pattern. And so that means that when I'm basically looking for this pattern differential, I'm saying, I see a shift that may be troublesome, and here's the pattern I'm seeing. And so her daughter, who's in the next day, can actually see something and say, hey, I might want to bring this to the doctor. And that her professional caretaker, who drops in 2 times a week, can also see that. But we're also basically looking at this personalized data and saying, hey, Mrs. Becker is a 65-year-old woman with high blood pressure and diabetes, right? And so when we look at that and we see this pattern, what else can we discern? What we would do is compare her in an aggregated anonymous data and say, other women who are 65 with these 2 like medical conditions, with this type of pattern differential, 3 months after we see this pattern, 30% of them had a fall. 6 months later, 60% of them had a fall. And so for us to then take not just personalized data, but also match it in aggregate data is basically where we're going to get to predictive health. And so that means that the integration of AI and being able to see all of these patterns and being able to be personalized to you is where the future should be. And this is part of the reason that drove myself and a lot of the people recruited to work at this company, because we really think that this shouldn't be an old school business anymore. It should be a well-connected, well-resourced, thought out AI experience so that the future is about a personalized care for you, not just a random monitoring like, oh, I see this data, that's great. Because today, everything has data aggregation. I just pick up something at CVS, and that CVS blood pressure monitor actually has the ability to aggregate your data. And they have an app, and that's really cool. But in isolation, they have very specific meaning, but it's only for doctors like yourself or others when you aggregate that data together and see the pattern together that you're seeing that there might be something more concerning. And so today, it's very difficult for a layman to basically pull the data together. And that, in many ways, is where we think the future of AI and personalized care need to be. And then we're a piece of that puzzle, along with other people's like IoT connected data. That pods of data have to be able to be aggregated and put together with AI so that we can actually discern something out of this. And we think that's really crucial for the trending in health in the future.
So interesting. It sounds like hearing you discuss this, that AI may be the missing link because there are all these different ways that data can get to perhaps a healthcare system or to a particular doctor or to a family member, but making sense of it or in real time putting it together is a lot trickier. And if you're asking somebody to look at a graph and they've got 30 patients with these different graphs, and you're trying to also take care of 30 patients in the office that day, how do you put it all together? So having this aggregation of data sounds like something that could really be life changing, life preserving. And then I'm also hearing this idea of helping people age at home and age with dignity in their own place, where perhaps they have family members that care about them, but they might be hours away, such as was the case in my family, where my mom was 6 hours away. There was no way for me to be really day to day involved in her care besides what she told me, which half the time she would tell me anything until it was too late. So, this idea that you could have information that could be helpful and family members could maintain that connection in a real way and then making that process seamless. And it sounds like that's an area where the work is also still ongoing, how to make it really practical. So, like you said, if they're in the bathroom and they're having their shower or something, they're not wearing the device, how else can we make this work for them? Or is there a way to make that work for them to make the process seamless, protective? So, as the IoHT and IoMT adoption grows, the data security and privacy are things that you alluded to. Those are major concerns. So, let's talk about some of the challenges and risks and opportunities in this regard. And how can innovators like your company ensure the safety and reliability of your connected devices? And more broadly, what are some of the industry best practices when it comes to managing data security and privacy, given that we are talking about monitoring people in the privacy of their home, their very personal experiences and day to day routines? And what are the barriers to widespread adoption of IoHT solutions? And putting all of this together, how can these questions and concerns be addressed?
Yeah, so I think that one of the major things that is of interest is every patient and every caretaker, personal caretaker, should care about HIPAA compliance and also personalized data as keepers of information. And we actually get some somewhat deep levels of information because we ask our caretakers to put into a caretaker app, hey, are your parents on? I always bring up Coumadin because it's the one that you can bleed out if you fall, right? And I use that as an example. But as we all know, when you're aging, or even when you're not aging, I'm aging all the time, but I also have bad memory sometimes. And in a time of crisis, emergency, you're not always going to remember things. And so we actually have information on people's medicines that they take, right? Because we actually have to relay it to the 24/7 monitor service if you're not available so that the EMT can actually do the best work that they can do. And so those are things that we take very seriously. And so that means that from best practices, you should be following the current sort of structure and how you capture data and segregate data so that there's safety. right? And we do that today. We have HIPAA compliant servers that we run on, and we basically have good cybersecurity hygiene and practices and policies. And also the things that we do is we think about, so how do we utilize technology to ensure that there is good hygiene, not just the typical server stuff, but one of the things that we do is we talk about, we're part of a company that actually does IoT connected products. And so do we really need to know, what it means when we had a fall? I can see that you had a fall because of the app, the caretakers are taking it out, but I actually don't need the actual picture. So today, we actually gone through a TSA, and I don't know if people remember this going back. The TSA machine used to basically show what seems to be like your entire body. Like it was very disconcerting to see my inner, like on a screen and have other people see that. And so because the reality is they don't need that data, right? What they need is a framework of understanding and a pattern that's actually useful for them. And so we call that, what's the data you need? So today, if you had a fall, what we really need to do and we're doing is basically saying, hey, our technology on the edge computing side is making that decision and capture. We don't need you to take that edge computing data into the cloud where anybody can access it and perhaps God knows what happens in a transference. So that's first and foremost, like where does the data reside and can you delete it and all of the kind of stuff? That device remains with you. The computing is done on the edge, not in the cloud, because everybody's afraid of too much on the cloud. And so we gather just enough information that we feel like is needed to make that discernment of a fall or not a fall. And that could be anything, like maybe we process and see that it's a stick figure on the floor, but we don't need to see you splayed out naked, right, in a bathroom or anything like that. So that's a first and foremost. And then we also tokenize the data so that we take pieces apart, so that when they transfer whatever data, they actually are transferred in a way that's safe, right? And so edge computing, tokenized data that allows us to basically ensure that these things aren't pulled together easily and put back together and associated with you. I think those things are important. And those are, I think, the things that you should expect and want in best practices. And the ability for multi-level usage. If I have a care village, maybe my daughter is the person who should have the most master data for me, but maybe my next door neighbor is a part of my care team and care village. Maybe she needs to know what meds I'm taking, but doesn't need to know that I have a heart murmur. And so being able to control the levels of data as a family and as a group is actually important there as well. And so we look at all of those different pieces of aspects of being part of a care village and the person who's being cared for. And basically, we look at long term, if you're going to have people aging in place and be part of a larger sort of experience, then those are all of the things you need from a best practices privacy perspective. And that's not even counting what you should expect from AI and controlling AI.
Yes, and that idea of privacy and AI and taking our personal data is such a hot topic across all industries, but it's certainly at a pivotal point right now when it comes to devices and wearables and other health focused technologies, as you explained. And how do you see this connected care device industry continuing to evolve with AI? And what might that mean for health outcomes?
I think that what you're looking for is ensuring that the data that you're capturing for AI trains the AI, especially for us, what we care about and the future of personalized care. Really, what AI and ML allows us to do is to be able to get to personalized care, which is so important. It's astounding what AI can do today. But what we want to do is to actually give them just enough data to basically do what they need to do, first and foremost. But we also need to understand that AIs make mistakes. And I think they call it hallucinations. I don't know why. I just call them mistakes, but we in practice use the word hallucinations. And so, how do you best ground the technology and be very good users of AI that doesn't mess with anything? It's one thing to basically use ChatGPT to paint a picture of you, and the picture has six fingers, and so, haha, that's so funny, and whatever. But we're starting to use and see AI in real life world experiences, that it's crucial that the AI's hallucination is suppressed or managed against. And that's especially important in healthcare. We've already seen sort of areas of stumbling, for example, in the law, right? There was a case in California where a young law associate utilized ChatGPT or something like that to basically do fact checks or do a written memo, and the AI created a case, right? And hallucinated a case and created a case. And then everybody went back to look for it, and they're like, this case doesn't exist. And so we can't really have that in health. And so the best example I can give is that, so today we utilize healthcare, AI in healthcare for us, for example. We want to say, hey, this Mrs. Becker, who is 65 years old, help us understand if something looks like it could be a fall. So if the AI's job is to come up with scenarios on probability, and it might say, this is a potential fall, and this is a potential fall, and this is a potential fall. And that's crazy because you're painting a billion scenarios because it's a computer. But what we need to do is to ground it and say, Mrs. Becker lives in a one-story home, and she's 65 with arthritis. Okay. So like she is not crouching tiger, hidden dragon. So she's not going to do those crazy scenarios that the AI painted. And so we actually, for example, for us, in our technology have a personal physics engine. We know that you're 65 years old, you have arthritis, so that scenario is highly improbable. And so we eliminate those types of things from a probability perspective. And so this is how we start living with AI and utilize AI in a way that controls the AI and make it really applicable to the way that we look at the world today. We use things like this, like we know, for example, in the world that we live in health has multiple parties in play. There's a person who's being cared for, there's multiple caretakers, both paid and professional, and then there's health insurance companies. And so all of those players are in somewhat of an economic term, they're in a game theory play together. So what's the best health outcome is the game theory. Like we really want the maximum outcome for the user, but there are players in this particular market who, for cost purposes or for whatever purposes, the maximum outcome isn't necessarily what they want to see in that environment from a cost balance perspective. So we put in things like game theory as part of our patents, right? To say we want to maximize health outcome, right? Despite of the differentiation of where the players might be in a situation. And so what if the professional caretaker didn't show up, even though they were supposed to be here and they didn't show up 3 times? So now we know that there is a situation where that data is not being transferred or data is not being taken care of. And so this person's going to come out with a worse health outcome because she was supposed to get care 3 times a week. She only got it once from a professional. So for us, like this is where we see the application of AI and the utilization of AI technology applied the right way can really maximize health benefits for everybody involved.
Great. Yeah, it certainly feels like right now we're in this experimental stage, at least in the general public with AI. I think some people have, as you described with that particular lawyer, and I've seen it in the medical profession, unfortunately, people using citations from AI generated report to back up a statement when that journal doesn't actually exist. Certainly, I think all of us have seen people writing things that clearly are not real. And so I think we're just learning as we go, but it sounds like your company obviously is taking all of those potential risks into account and using AI in a way that is going to elevate people's health and not take over the human aspect of care, but augment it and give us more opportunity to provide the best care possible. And one of the promises of IoT is improving both accessibility and equity in healthcare. And so this brings us to what are some of the ways that LogicMark's technology might be able to contribute to bridging those gaps in access to care. And I'm curious if there's any partnerships or initiatives in place that might help to extend its impact globally. For example, I noticed that your website references a partnership with the U.S. Department of Veterans Affairs, which you also noted, and more broadly, talk to us about how connected care devices are creating those new channels for accessibility and health equity.
I would say that it's not just about IoT accessibility, but it's just overall health access accessibility for medical alert products, right? So today, the more technology infrastructure we built in, the more difficult in many ways it is for a lot of people to get the same level of connectivity. When we talk about and being on this amazing show and being on a podcast, we're all connected on the internet and we all have cell phones. Because we work with the Veterans Administration, we also serve a huge population of veterans who don't actually have very good connectivity today. They live in rural areas where internet connectivity is very poor. And so even when we could get a connected device into their home, they actually can't use it because cellular networks doesn't penetrate where they live. And so one of the things that we have worked really hard at is we've looked at basically accessibility. So do we have devices and do we build devices that are able for you to be able to access that even if you don't have cellular network. And so today, the Freedom Alert Max, for example, it is a Wi-Fi enabled product. And so there are ways for you to utilize the device in your home if you can get cellular Wi-Fi potentially. We also sound so old school because I can't even believe I'm saying it for myself, is that ironically, we sell so much landline based medical alert products. And even though there is less and less people there, one of the few that still makes that product. And the reason why we still keep making it is because there's just people who live in areas, they have tin roofs or they have very poor cellular networks, and they just cannot get access. And so we really will continue to make these products until everybody has the same cellular penetration that everybody else in the left side, right side of the coast and big cities can get, because there are definitely places in the US that does not get cell phone networks. And then the other piece is cost. And so today, these services, they're recurring subscription models and they cost $34 to get 24/7 monitor service from a US based company. They cost money to get advanced fall detection. They cost money to do geofencing for memory care patients. And so they're costly. And for a lot of people who are senior and on fixed income, they can't afford a monthly fee. And so we have been committed and will continue to be committed as a company to create basically a no monthly fee product. And we do that, and those devices will always be able to help you reach 911. We do so that, again, you push a button. We're one of the first and one of the few to basically put a 911 product with fall detection, because what if you had a heart attack and you can't push a button? So at least it'll connect you to 911 if you're able to speak a little bit and get the help that you need. It's a fixed cost product. It's not monthly feed. And so that way, those with fixed and lower income can still actually get a medical alert product, because everybody deserves safety at the end of the day. And so that's the things that we're really committed to around sort of equity and so forth, so that we feel like medical assistance should be given to as many people as possible.
Great. I think that's such an important point about the rural areas in particular. I know as a cardiologist, we had a number of patients in that situation who would come in to the city or the suburban areas for their healthcare, but they might live hundreds of miles away where internet just wasn't available, wasn't good, or even it's hard for us to imagine who live on the internet, but some people are just not comfortable with that, especially older people dealing with these devices. They don't always feel comfortable. So I think that's a great service that your company is offering to give people that option if they can't access the internet. And I think, again, the accessibility of rural people is probably one of the most important issues that we're dealing with in this country with healthcare. There's so much going on in healthcare innovation and health tech that it's difficult to hone in on all of the development. And that also provokes a thought of what might we be missing. So from your perspective, what are we not talking about that we probably should be?
I think that's a really great question. I really think a lot about, I love that you talked about accessibility, because in the rural communities, we see the ability to access, right, the internet or connectivity or, and all of those things. And is there a way to equitably bring those to the table? Because even if you are in an area where you have some cellular connectivity, cellular costs are really high, and you're living somewhere maybe 200 miles away from the nearest clinic or doctor. And so how do we look at the ability to bring telemedicine, for example, in rural areas, and how do we do it in a way that's easy? It always seems like it would be easy to do a telemedicine sort of conference, but it's actually so surprisingly difficult to make user interface easy for something like that. And so how do we bring it to a population of people who have a difficult time accessing healthcare because of weather, connectivity, if they're stuck in a home because they're less mobile? And how do we bring healthcare telemedicine to people who might not be able to readily access not just basic healthcare, but even specialists? And so we see our devices as one of the early ways to do this, right? We have a camera front and back. And so we hope that we can make the user experience in the future easier, whether or not they're using our devices to do so or any other means. But it is sort of a foot in. We hope in the future that might be able to help people get some of that care that they need. Because that's the thing I think about the most, is that if you are in a place where you can get access to all the great specialists, basic healthcare, what's the best way we could get that to you? Nothing like COVID to basically bring up some of the scary things I remember when we were all in lockdown. And I remember listening to NPR, and some elderly people called in and said, I don't have a computer at home. And I usually go to the library to basically do things on a computer, but now everybody's telling me that I should look online and look up this information about health, and I can't get online. And so that really brought it home to me that I think there's an inequity in terms of access to healthcare data and healthcare overall and specialists and basic care. And so if there's anything that we really need to advance everything, is that's really the thing to focus on.
Such an important observation. So, in closing, any final recommendations for those of our listeners who might be interested in staying connected to your work within the connected device space? And any key points that we didn't cover that you'd like our listeners to know? And also, feel free to discuss any upcoming product or partnerships or key milestones that we should be looking out for. And finally, any topical recommendations, such as books or other content that you believe might help our listeners.
Sure. I think the thing to think about for a lot of folks that I always want to get across is that, when I had a baby, I had 9 months of plan. A baby, I got to baby proof my home. I got to do all the things to get ready to bring a new member into my home. And so I think the thing that often takes people by surprise is how quickly things move when your parents become ill and something happens, but they still want to age at home. And so I think the key here is to me to also always bring up to people, and I advise people, have those discussions early. Do not be afraid to have discussions about how you prefer to age at home. It's never too early to start thinking about age proofing your home. Rugs are really challenging. You could trip on them. How you lay out your home. How do you ensure that you can actually maximize your time in your home as long as possible and that you're more comfortable with it safely? And to have those discussions with your loved ones so that there's a plan in place. And sometimes these things happen really quick, and then by then somebody's sick and there's a lot of stress and drama and fear. And so that's not a good time to have those discussions. So it's best to do that. We aim to have an aging guide, and that should be coming up very shortly, if not already out. So we will be sharing that. So please be on the lookout at logicmark.com for that aging guide. We talked to a lot of experts, not me, about how to do it safely. And I guess the other piece is, do not be afraid to wear these devices. They could be attractive, and it's not a marker of being old. Just like ARP includes people who are 55 now. There's no shame in wearing assistive technologies. Everybody's wearing an iWatch. And so everybody cares about their health. And so wearing a device is not a negative. There's no shame in wearing a device that's going to help save your life. So no stigmas.
Wonderful. And that is bottom line, being proactive in designing your own life as you age. Thank you so much. My guest today has been Shylin Simmons, the CEO of LogicMark. And we've really enjoyed having you on the show today.
Thank you so much for inviting me.
Thanks for listening to this episode. TechLink Health is a healthcare advisory platform for consumers and organizations to stay informed with the latest insights while connecting with healthcare experts for telehealth, e-consults, and consulting services. For more details, visit www.techlink.health.